During COVID times, the sleep service was under a lot of pressure. We were struggling with capacity at the hospital site with social distancing, and we needed to move to a new location. We moved to the community centre in Hereford to help provide more capacity and support our patients. We managed to expand our capacity from 5 clinics previously per week to now 12 clinics per week. We help a lot of patients with complex conditions and conditions with breathing problems as they sleep, a condition known as sleep apnea and or snoring problems. And essentially they use a mask interface to help improve their breathing at night, and then therefore they get better quality sleep. Then wake up feeling that get up and go feeling and more refreshed sleep rather than having a sleep hangover. That has a great impact on a lot of other health conditions like heart failure, diabetes, stroke, reducing the risks, and also mental health. A lot of patients feel their mood is suddenly lifted, their concentration improves, they're more engaging with family members and friends. Many patients are referred to the sleep service, roughly at the moment 600 per year, 30% increase on a previous year. A patient typically gets referred to the service from their GP or a hospital practitioner. Suspicion of stop breathing or snoring problems that's affecting their sleep quality at night. We then provide sleep studies that are done at a home environment where we can diagnose and check whether or not sleep apnea is a problem, and then treat them with the appropriate therapy and or treatment advice. We've expanded our team here at the service to meet the new capacity demands. So we've got a good team of associate practitioners, assistant practitioners, clinical scientists and sleep specialists. They like to call themselves the dream team. We've received great feedback from patients. They described improved patient access to the service, improved experience for the patients, ease of location access, and a comfortable environment where they consider the service as being life-changing. I would like to thank the sleep service and all the members of staff as they go above and beyond every day to help patients in the community with this condition. I would also like to thank the Hinton Community Centre and the trustees for their ongoing support and commitment to improving health.
We launched a multidisciplinary project to improve the care for people with diabetes in Herefordshire in an integrated way with primary care and other partner organizations. We have developed 15 diabetes champions, and that meant we got more skilled workforce out there in the primary care. The work that we have done so far is an excellent example of collaborative multidisciplinary working, which has hugely helped our people with diabetes in Hereford. One of the work stream that we have developed collaboratively along with our pediatrics colleague is transitional care pathway. This pathway helps to seamlessly transfer children and adolescent age group to the adult clinics. So we do clinics together between the pediatrics and adult teams to care for this young adolescent group age 17 to 19. By doing this, they feel better supported and the handover is good between the teams. We have also developed and implemented a clinic for age group 19 to 25 as they are at high risk and their care needs are different. By this way, they feel better supported. Another work stream that we have worked on and implemented is diabetes perioperative pathway. People with diabetes who have elective procedures, their diabetes needs to be optimized. Generally speaking, there is a lot of data which shows that people with diabetes have poorer outcome, and hence diabetes care needs to be improved. With this pathway, there is timely intervention and ability to improve and optimize diabetes care for people waiting for elective surgical procedures. We were one of the first in the country to implement real-time CGM, which is continuous glucose monitoring in people with type 1 diabetes, and that has revolutionized the care for this cohort of people when they get pregnant. We also have developed or implemented what we call remote monitoring for people with gestational diabetes. That has reduced the number of hospital admissions and has also helped us to give real-time or near real-time advice rather than waiting for appointments. So using the continuous glucose monitoring technology, type 1 diabetes, when women are pregnant, they don't need to do the fingertip test monitoring anymore. Previously, they would have needed to do the test between 7 to 10 times a day. With the newer technology of continuous glucose monitoring, the glucose gets monitored continuously using a sensor which sits via a cannula under the skin, and it is continuously measuring the glucose readings. Patients feel that they have more support and more visibility from the teams both in secondary care as well as in primary care. We have had informal feedback from patients with regards to the technology that they have been availing. They are very pleased about it. All these various work streams and the work that we've been doing has happened because of the huge support that we have received, and I am thankful to the senior management, our specialist diabetes team here in Hereford County Hospital, primary care colleagues, and the CCG, along with Diabetes UK and other partner organizations.
We have re-established the outpatient chronic pain service into Herefordshire, which we have set up to be integrated with the already established inpatient acute pain service to provide integrated care for adults and children who live in and around Herefordshire. We initially had to establish the need for the service, so we demonstrated that there would be improved cost effectiveness and quality of care for patients living within Herefordshire by relocating the service back to County Hospital and the Wye Valley Trust. Living with chronic or persistent pain, which is difficult to manage, is extremely common within the adult population and affects everybody from all walks of life. It affects every aspect of a patient's life, from their social life to their ability to look after their families, to their ability to work and earn money, and just to enjoy the things they would want to be doing. So the overall aim of how we manage pain is to make sure that our patients can live their best possible lives. We initially set up our administration side of the service and then expanded the service into the clinical areas. So we've recently appointed 3 clinical specialists from nursing and physiotherapy backgrounds who will deliver care across the inpatient and outpatient settings. We benefit patients in a number of ways. They have to travel less far to us, so that makes it much easier for patients living with painful conditions. They get to know us, so patients who are living with persistent pain who need to come into hospital know us as familiar faces from outpatient clinic, and then we can follow their journey and support their specialist needs throughout their journey in hospital and follow them up afterwards. And the beauty of the service that we can provide is that because we know them, they don't need to retell their story to us. We're also well embedded within the community, so we provide support to, for example, the hospice, the community hospitals, and we work closely with our primary care colleagues and local pharmacists as well. One of the advantages we also have is that because we provide integrated care between the hospital and the community, we can support early discharge of patients. We very much like to thank our clinical directors, past and present, for their huge support in establishing the service and running it to date. We'd also like to thank the directorate management team for all the behind the scenes work they've done. We work with the most wonderful team of friendly, approachable, think outside the box physiotherapists, nursing staff, administrators, without whom we wouldn't be running anywhere near such a high quality service. So I'm delighted and privileged to work with them every day.
We've delivered an energy saving project here at the County Hospital, a multi-million-pound project which is saving 600 tonnes of carbon a year and about £100,000 worth of fuel costs. We have a project team made up of Centrica and Mercia and Sodexo, and I coordinate their activities to ensure that they deliver what we need to do to complete the project.
We looked at the sites around the county hospital predominantly and looked at where we could install ground source heating, so the types of buildings that were able to be upgraded. So we've installed a number of boreholes, 47 in total, into the ground, 650 feet down, and that then uses water to exchange at a low temperature to generate heating, so instead of using gas boilers. Some of those buildings weren't able to be on the ground source loop just due to location on site, so we've used air source heating. It also reduces our reliance on gas, so we've become a non-gas site.
Much of the county hospital energy infrastructure was gas-fired and nearing its replacement date.
One of the measures is LED lighting. We've replaced around 3,000 fittings on site. It's predominantly at the county hospital site, but also the outlying buildings. This continues with the work we've been doing around the community sites, and it takes our total estate to about 75% LED lighting. The other things we've been looking at is insulation. So in some of our plant rooms, we've got lots of large pipes with hot water running through them. We've used new insulation and insulation jackets to insulate those effectively to stop wasting the heat at source. One of the other technologies we put in is solar panels, photovoltaic. We've put those on the roof. We've put in enough to power what the equivalent of about 32 average UK houses. And that's been really good. It's something we've been looking to do for a few years, and this was the first opportunity we've had to be able to install it.
As a result of the project, we will reduce our carbon footprint, create a greener environment for the people of Herefordshire, and we are aiming to be fossil fuel free by 2040.
And the less reliance we have on gas and greenhouse means we're actually protected from future rises in volatility in market and inflation. So as the gas prices goes up, we'll actually be protected from that. One of the other measures that we've installed on site are 67 Coolnomics devices, which are the controllers that manage our AC units. What they do is they trick the unit's compressors into turning off earlier. So rather than them running on until they reach temperature and get a delayed sensor, they actually turn off in advance, which then allows them to cool at a slightly slower rate. Doesn't mean any notice for the people inside the rooms, but does save energy. As part of the ground source heating and the changes that we've made to the buildings, we're able to not heat them 24 hours a day, and we've been able to change the heating profiles, and that's very flexible based on outside air temperature, so it's going to be an intelligent system rather than previously where it was on 24/7.
The project has taken 2 years through design and implementation, and it's fantastic to see that it's now been completed.
As part of the project, I think I'd like to thank the estates team, but also the others that helped, they made it proper. So we had procurement that supported us during the initial phases. We've had Centrica Business Solutions that helped us with the actual delivering the work, Sodexo, Mercia, also the clinical teams around the departments when we've had to do shutdowns. They've been really good at accommodating.
We have opened a dedicated adult emergency pit stop assessment area for the emergency department. The idea of that was to provide a streamlined and more efficient service for patients coming through the department. It runs 24 hours a day, 7 days a week for all adult patients. We already had a rapid assessment area for ambulance arrivals, but we weren't doing the same sort of thing with our walk-in patients. Now all of those patients go through Pitstop and they have a rapid initial assessment. They can have blood tests arranged, they can have ECGs, other initial investigations such as x-rays, CT scans, all requested from that first meeting with the team. This means that their journey through the department is much smoother and much more efficient. If the patient clearly needs to be admitted under a speciality team, the Pitstop team refer to those speciality teams. And instead of the old system where somebody would be triaged and then wait to see a doctor and then have their investigations ordered and then have the investigations and then be referred as necessary, we can get them to the right person straight off. Instead of the patients waiting in the waiting room, having had a very brief triage from a nurse, they get seen by clinicians straight away. They also get that nursing input as well. They get their analgesia quicker, they get their investigations quicker, they get their blood tests quicker. It just makes a much more streamlined service. We equipped our senior nursing team with in-ear radios to improve the communication throughout the department. It's really helped with the communication. You're not waiting for somebody to pick up a phone. The right person is on the end of the radio as opposed to the wrong person picking up the phone. So that's really sped things up as well. The whole concept for Pitstop was developed with the entire emergency department team, so from receptionists, healthcare assistants, nursing staff, porters, everybody chipped in with ideas and since has worked to make it the best system. So we had some really good feedback, not just from the patients but from the staff in the department as well. The junior doctors who are seeing patients further on in the department have already got the groundwork laid by the senior team at the front door. And we've had great feedback from them to say how much better their experience of working in the emergency department has been. We run the Pitstop area 24 hours a day, 7 days a week. It's fabulous given how small we are as a hospital and a department that we're able to provide this service.
We were delighted to have opened our new ward block in December 2021, which has replaced the 1940s hutted wards, which have served us well for many years. This is a purpose-built, state-of-the-art facility designed in a dementia-friendly way to provide a purpose-built environment for frail old people admitted to hospital. None of this could have been achieved without the £23.6 million government funding.
I work alongside the matron for frailty and ambulatory care. So I've been in post for 12 months. We may be a small trust comparatively, but the ambitions we have for the service are huge, and we're going to keep pushing forward to try and achieve them.
It's well known that large numbers of patients presenting to the emergency department are older and frail, and this resource will enable us to provide high quality care in a purpose-built environment to improve both quality of care for older patients but also to improve outcomes for older patients.
These patients have quite unique needs. They require input from a broad range and a really interlinked service of different disciplines. Frail patients don't do well in an acute hospital setting. The best place for them to be is out in the community, recovering in a situation they know. So our real focus is to try and get these patients through the hospital system, treat them as effectively and quickly as possible, and get them home with the right care and support for them to recover at home and to stay at home.
It has been a challenge since it opened due to the impacts of COVID, as the wards were used to cohort COVID patients at the beginning, but we have the vision for how they are going to be used in the future. We named the wards after hills of Herefordshire, having run out of rivers, and the hills that were chosen were Dinmore, Ashgrove and Garway. Dinmore ward is our top floor ward, which is an orthogeriatric trauma unit, which has enabled us to totally redesign the care and pathway for patients presenting to the hospital aged over 60 with a fractured femur. Garway is our middle floor ward, comprises our 16-bedded frailty assessment unit and will be the base for our soon-to-be opened frailty SDEC area, which is same-day emergency care. And this will enable even more patients to be seen, assessed by specialists and discharged to prevent an unnecessary hospital admission. Ashgrove ward is our ground floor ward, which is a longer stay ward, and the wonderful thing about Ashgrove shows the importance of clinicians being involved in the design of these wards. So we were able to incorporate a relatives room, which provides us with a non-clinical area to have private, often sensitive discussions with both patients and relatives. We have a dementia resource room, which is a less clinical area with comfortable seating and activities to engage and stimulate patients with dementia. And we also have access to our soon-to-be-built dementia-friendly garden, which will enable outside space for patients and relatives. Patients benefit because they are being looked after in a purpose-built unit and cared for by staff who have interest and training in the management of frail or older people.
The feedback we've had from patients from the frailty wards is usually that they have a very different feel. The response they get from us and from our teams, we talk to them more about their own individual goals, what's important to them, where they want to be and what they want to happen further forward in their care. It's an approach that takes into them as a whole person rather than acute medical care, which can often be very focused on the issue at hand. We take a much broader approach, and the feedback is often that patients feel quite valued and they feel that actually we are addressing what might be less obvious problems but are actually a really big issue for them.
As a geriatrician, the fact that we have been given this purpose-built facility for the care of frailer old people shows the value that the Trust places on ensuring that they get the best possible care.
I'd mostly like to give a big thank out to the volunteer service who've been amazing, and also the wider Trust who really stepped in and helped us move into the new frailty block.
There was a large project team that had multiple staff members involved with, and a special shout out to all staff involved, especially the estates team.
I'd also like to give a really big thank you to the frailty team themselves. They've taken on a massive challenge. They have been really up for looking at new ways of working, developing a new service, and really changing the way we approach things to provide the best service we can, and they're really dedicated and passionate about the care of frail people.